Bismillahirrahmanirrahim. My name is Dr. Amber Arshad and today my topic of presentation is Trichomoniasis under supervision of Professor Dr. Saira Afzal. In this presentation, I shall be explaining what is trichomoniasis and the causative agent, the epidemiological factors, chain of transmission, clinical manifestations, levels of prevention and control, recent advances, and an MCQ session at the end. Therefore, at the end of the presentation, the participants will be able to describe the epidemiological aspects with preventive aspects of trichomoniasis, with global updates and recent advances. So what is trichomoniasis? Actually, it is a part of these sexually transmitted diseases and is caused by a protozoan called Trichomonas vaginalis. And although the symptoms of the disease vary, but most of the people have the parasites, but they cannot tell that they are infected. So in comparison to other STDs or for example chlamydia and other STIs or STDs, the prevalence among women of age 15 to 25 years of age, this trichomonas infections is slightly high, and also this infection peaks when the life goes towards the age of 40 to 50 years of age. And this infection is mostly asymptomatic and in 50% of women and 70 to 80% of men. But when the full symptomatic disease develops, it's very painful with vaginal and urethral discharge and painful urinations, and have also adverse effects if the pregnant women acquires this infection, with resulting in premature births, rupture of membrane, preterm births, and low birth weight babies. To control this, WHO gave a strategy for the sexually transmitted infections for the control of these STDs, and this was 2016 to 2021, and the strategy includes the rapid scale up of evidence-based interventions and service to end sexually transmitted infections by 2030. And this strategy sets the targets to reduce reduction in gonorrhea, syphilis in adults, and also other sexually transmitted diseases, and establish a baseline incidences of infections that occurred during the year 2018. So the primary objective of this whole strategy was to estimate this 2016 to 2018 prevalences, and also to set the baselines for the reduction of these STIs and evidence-based interventions. So this is a case in which a 18-year-old girl presents with her mother, and she has no past medical history of any kind of disease. And after her mother leaves the room, the girl admits that she had some relationship with some other person, and since she had a vaginal discharge. And after investigation, it was seen that the causative organism was found in the pap smear, and also the symptoms were relating to the trichomoniasis. So this is the epidemiological triad, with starting with agent, and it is the protozoan that is responsible, and it's a flagellate organism. Host factors include more than one sexual partners, and other risk factors includes that limited education and low socioeconomic status. And it's a sexually transmitted disease, and host is the human is the only host for this disease. Environmental factors include there is no seasonal variability, and usually it resides in the female reproductive tract and in the male reproductive tract, that is transmitted from the males directly to the sexual intercourse. So mode of transmission has been discussed, and man is the only host for this disease. And other non-sexual sources are the fomites, like towels and toilet seats, and from swimming pools. And these trophozoites cannot survive outside, so the infection has to be transmitted directly from person to person. And as I've already told, that it is a part of the sexually transmitted diseases that also includes candidiasis, gonorrhea, syphilis, and HIV. And babies that get infected during births, fomites, they can have adverse effects, and the babies can have symptoms on on the skin, but no congenital anomalies have been reported, and incubation period is roughly 10 days. But it can vary with diseases. For all STIs, it's 5 to 28 days, but specifically for trichomoniasis, it can go from 5 days to 10 days up to 28 days, but only in women. So trophozoites are the main source, and mostly it's asymptomatic, but when the symptomatic disease occurs, it causes profuse odorous discharge, and a strawberry cervix is the cardinal sign for this disease. And in men, usually it's asymptomatic, but when it's symptomatic, it causes urogenital tract infections uh, uh, which can cause enlarged prostate and epididymitis. And mostly in men, they are asymptomatic, but they can also develop symptoms within the standard incubation period. So just going through the main differences between the symptoms for between the females and the males. The females have slightly severe symptoms as compared to men, and they may have to take uh, rigorous and continuous treatment as compared to men, but men are also recommended the same treatment, but in low dose regime. So there can be complications. For example, trichomoniasis can cause genital inflammations that makes easier for the person to get an HIV infection and to pass the HIV, because there is increased shedding of the genital tract tissues and inflammation, so that can cause more chances of acquiring this infection. And low birth weight babies and preterm babies are common with mothers if they get pregnant during if they get infection during pregnancies. So the levels of prevention. Prevention and control include safe sexual behaviors and avoid multiple sex partners, and use barrier methods and detection and treatment of cases either in male or female. Early detection and treatment. So there is a criteria that is made is use, get, be, limit, and do not abuse. So this is the main preventive criteria. So I've already I mentioned in the previous slide that use the barrier methods, get tested, and don't have multiple sexual partners. Keeping a single sexual partner is a safe practice, and do not abuse alcohol or drugs. In specific protection, there has been a vaccine that has been there for the animal use, and it's the Trichcard. It's a killed vaccine, and it's have two doses, 2 ml subcutaneous and given to animals, and second dose is 2 to 4 weeks apart. An annual revaccination booster is also recommended, a single dose. But no vaccine for humans have been developed yet. So for secondary prevention, there is early diagnosis and prompt treatment. So diagnosis, actually the disease symptoms are sometimes mostly it's asymptomatic, and also the symptoms are overlapping with other STDs. So it's only based on symptoms, it's not possible. So for both men and women, the healthcare provider must examine and get laboratory tests for the diagnosis. So the laboratory test mainly recommended is microscopy, culture, antigen detection, molecular diagnosis, and some other tests. So for the specimen in women, the vaginal discharge or endocervical specimen is taken, and for men, the prostatic fluid is commonly taken, or semen is taken as a specimen. For microscopy, we use wet mount test, pap smears, direct fluorescent antibody testings. And for culture is considered as a gold standard for diagnosis, as we can easily visualize the flagellated motile organisms, and also adding on to the antigen detection in the vaginal smears by ELISA, and molecular diagnosis by PCRs. PCRs are highly sensitive and specific test for this disease, but not readily available. So mostly people rely on these cultures and on these microscopy tests. For the treatment is mostly medications like metronidazole, tinidazole, and pills. Is oral. It's an oral dose, and it's safe for pregnant females. And it's recommended not to drink any kind of drug or alcohol during within 24 hours of medications. It might affect its uh, availability. People who have been treated for trichomoniasis can get it again, and usually it's metronidazole 2 grams orally single dose, that is the recommended regime, and also the tinidazole same, but alternatively metronidazole 500 milligrams taken twice for 7 days. And when you get checked at 3 months, you make sure that you have not been affected again, and sooner if your symptoms come back before then you get your checkup again. So this was the paper that was recently published regarding diagnosis and management of Trichomoniasis vaginalis under the Center of Disease Control and Prevention for the STDs. And it recommended some of the latest diagnostic techniques that have been practiced. That newly available diagnostic techniques include point care assays and multiple nucleic acid amplification tests that can be performed on variety of genital specimens, including urine, and allowing more accurate and convenient testing and screening for those who are at risk. And repeat and persistent infections are common, so rescreening at 3 months after treatment is recommended. There is an also latest treatment regime, that is the in vitro antibiotic resistance has been shown to the this drug, but the standard suggested treatment according to this was metronidazole, but multiple doses. Actually, it was a randomized control trial with HIV uninfected women, and it demonstrated a multi-dose metronidazole 500 milligram, that is half of the recommended dose, that was taken twice daily for 7 days for 1 month. But the conclusion showed that the in women it can be taken in divided doses for 7 days because the results are good, but in men only the 2 gram single dose oral metronidazole regime is required. So some recent advances. This was recently conducted a systematic review for Trichomoniasis vaginalis and growing concerns over the drug resistance that have been seen in the previous few years. So the main treatment against this disease is metronidazole and some of the nitromidazole's derivatives. However, between 5 to 20% of the clinical cases are caused by this parasite resistance and shows resistance. Actually, low and moderate level of resistance to metronidazole was reported in this systematic review, and this review unveiled the need of standardized susceptibility testing to define the breakpoint of detection of metronidazole resistance isolates and the correlates. And it is also important to establish a criteria to define the clinical resistance to the metronidazole, such as consensus would foster the development of surveillance studies about this clinical and microbiological response to metronidazole treatment. So further, a lot of work has to be done on this subject. And second is the novel treatment approaches to combat Trichomonas vaginalis that also showed that the standard treatment remains metronidazole, but since there has been resistance, so further in vitro and other studies needs to be done, and clinical trials are still focused on the new routes of administration of conventional drugs. In addition to nanotechnology approaches in their infancy, shedding light on potential possibilities for creating a more effective and target and safe delivery system is also necessary. So now coming up to the MCQ sessions. So the first MCQ is a 28-year-old African woman comes into this STD clinic and gets screened for these STDs. And she has the past history, positive past history. The routine screening ordered for this women includes screening of trichomoniasis infections. Which of the following would you recommend as the preferred screening test for detecting the Trichomonas vaginalis infection in this asymptomatic women? Either it's wet mount, it's NAT, it's culture first of urine, it's culture of midstream, or PCR.
A.
Yes, A can be the answer, but here if the services are available, then NAT or NAT would be the preferable option. A 39-year-old woman presents to a clinic with a 5-day history of abdominal increased and slightly malodorous vaginal discharge with dysuria. And she also have been point care tested for HIV and pregnancy that were negative. Vaginal swabs were taken and they were positive for Trichomonas vaginalis. Which one of the following represents the best option for the treatment of this women's infection? Either it's metronidazole infection for 2 grams orally single dose. Either it's metronidazole 500 grams twice for 10 days, or the remaining options with 500 grams for 3 days, for 2
A.
grams. Yes, the standard
C.
treatment for women remains the metronidazole 2 grams orally in single dose. But now new recommendations are also getting in line, but still under study. A 24-year-old woman recently diagnosed with HIV infection presents for her initial visits with her new primary care provider. She acquired HIV through unprotected intercourse, and she is feeling well without any specific complaints. Which of the following is true regarding this Trichomonas vaginalis infection in women with HIV? Trichomonas screening is not recommended since women has HIV. Lower vaginal and endocervical HIV RNA levels there are low. An increased incidence of pelvic inflammatory disease, increased genital tract, and enhanced HIV shedding. The recommended treatment of trichomonas is same as in women with HIV and reduced HIV genital tract shedding.
B.
Yes, C is the right
B.
answer because whenever there is trichomonas infection, the risk of transmitting and acquiring HIV increase through enhanced HIV shedding, pelvic inflammatory diseases, and increased genital tract infections. So fourth is a 19-year-old man returns home for the first semester, and he is anxious about these STDs. A plan is made to perform his basic testing on urine and all, including HIV. He mentions that he read about this trichomonas on internet and asks about the test. So which one of the following would you recommend regarding testing this man for Trichomonas vaginalis? Urethral swab for sorry. So which one would you prefer for this person if he comes to you for a testing? Which specimen would you recommend? A urethral swab for trichomonas, a urine sample, urine nucleic acid amplification? Do not offer testing and there is no clear benefit of screening an asymptomatic man, and microscopic sample of trichomonas vaginalis.
C.
Actually, in men, if they are asymptomatic and they are just acquiring and just anxious about this STD, so normally there is no benefit of testing such asymptomatic men, as the disease symptoms and the disease severity is light. So if the person is asymptomatic and request screening, so mostly it's not recommended, so D is the right answer. What specific species of protozoas cause foul smelling vaginal discharge with itching and burning, and on physical examination shows a fiery red cervix? Either Xanthamoeba, Trypanosoma, Trichomonas, Leishmania, or Plasmodium.
C.
Yes, these are the typical features on examination when we get Trichomonas vaginalis infection. A young woman goes to her doctor with a variety of medical complaints. Her mucosal surfaces are tender, inflamed, eroded, and a pear-shaped protozoan is seen on the culture. So, which of the following would be the specimen of choice for such women if you want to take a culture for other for testing on other females as well? Either it's biopsied muscle, blood, duodenal content, sputum, or vaginal secretions. The preferred,
E.
yes, E is
E.
the right answer. The vaginal secretions is the choice of specimen for women.
E.
Yes, E is the right answer. A 25-year-old woman at 20 weeks of gestation is told to that her infection can cause severe preterm but a very little effect on the baby in terms of congenital anomalies. What is the single most likely organism responsible for this clinical characteristics described? Cytomegalo, herpes, hepatitis B, gonorrhea, or trichomonas?
E.
Yes, trichomonas vaginalis. Among all these STDs related organisms, Trichomonas has the least chances of having a congenital deformity if acquires during pregnancy. What statement about Trichomonas is true? It's a sexually transmitted disease caused by a protozoan. It's usually incurable. Men often show symptoms while women do not. Yes, A is the right answer. Um, um, Often here the word often is discriminating this last option. Otherwise, if often would have not been here, then E could also be the right answer. A young woman represents to a genitourinary medicine clinic, and after a vaginal swab was taken from the posterior fornix, microscopic examination reveals Trichomonas vaginalis. And mostly at what stage this Trichomonas is transmitted and causes disease? Either cyst, oocyst, egg, sporozoite, or a trophozoite.
E.
E is the right answer. Usually you see a trophozoite of this bacteria whenever you perform this gold standard technique, that is the culture. And last is a 63-year-old woman is evaluated for 3-week history of vaginal discharge. This discharge is described yellowish and malodorous and burning with a positive Trichomonas vaginalis. The treatment with single dose metronidazole is planned. Which of the following is the most appropriate additional intervention? Confirmed infection with nucleic acid amplification test, perform repeat pap smears, test for the cure of the following, treat the patient's sexual partner, counsel the patient, and send her home. Additional intervention. That is the D, that treat the sexual partner as well by the recommended dose, that is 2 grams, 2 grams single dose metronidazole for I think 5 to 7 days. Here is the key, and thank you so much.
Thank you very much, Dr. Amber. Very nice presentation, very elaborative one. And I hope that everyone who are participating in the discussion, they are very clear about each and everything. But still, if there is any ambiguity, please do let us know if anybody has any question. Okay, thank you very much. See you next time. Allah Hafiz.
Allah Hafiz, ma'am.